So let me have my presentation now at the end before we open up for the questions and answers in a panel discussion. So I'm going to talk about building smart quality, and we have been listening to experts, smart build, operation, and the third theme is quality. And so I just try to make sure that things are easy to understand and you know how to make in the hospital is smarter in operations, in building, and as well as in how you brand your hustle and as well as grow in the market. So this is very current. I think just last week it's released by United Nations Industrial Development Organization UNIDO, which is a UN organization. It says smart quality infrastructure for sustainability. And I would encourage all of you to please read this document, only 10 pages of document, hardly a couple of lines, but it's very informative. So it talks about how you really think smart and think about the smart quality. And there are 4 pillars out of it. If you look at this picture and it says smart quality infrastructure, quality 4.0, you know, that's the age which we have already walked through. All 3 stages we have through been, and now it's 4.0, which is talking about smart metrology. I'm not sure whether you understand metrology. In true sense, the metrology is the measurement, basically. Most of the lab person, the laboratory person in a hospital, if you have a medical lab or a blood bank, they know what is metrology. Metrology means measurement. And you use equipment, you use biomedical equipment, you use in your laboratory, you use thermometer, you weighing valence, you use pipettes. So all these are actually need to be calibrated. And when we talk calibration, that's about the measurement, you know. You say, and even you infusion pumps, you use ventilators, use different medical devices, they all need to be measured and used for measurements. Whether you say infusion pump used for delivery of say 5 ml of a infusion in per second or per minute or per hour, that need to be measured whether that's correct or not. So that's very important. We need to be smart in measurement. Without measurement, we won't know and we won't be correct in our doses, right? When you prescribe medicines, its flow is 5 ml per minute. How you make sure it is 5 ml which you think is 5 ml? When you say it's minute, what you say you really your watch, your clock is correct or not? When you say I'm taking 5 grams of something, when you are weighing a patient, particularly those patients who are vulnerable and their age is specific, treatment need to be given. If you know if a patient is, the neonate is 3.5 kg, are you sure it's 3.5 kg? So all this comes under measurement and it's called smart metrology. And second thing comes the smart standardization. It talks about uniformity across the organization. It talks about how you standardize your policies, your procedures, your processes, so that everyone talks same language, same matter, irrespective of who comes, who goes. So anyone comes to your organization talk the same language because you have standardized your processes. So it talks about it's going a level up, and you keep hearing in digital technology, AI, ML, artificial intelligence, machine learning, and so on. This also talks about that, those tools and technologies in making your standardization post more smarter. And the third component is smart conformity assessment. Again, I think this may be a new term for you, smart, leave it smart, but conformity assessment. Conformity assessment means you're checking something for its conformance to some requirements. For example, when you test a blood sample, you are taking blood sample for something, say the sugar in blood sample. So when you test sugar in blood sample, you are conforming to some requirement. You have food items, any food items, you're testing it for say heavy metals or pesticides, you are conforming to those requirements. That's called conformity assessment. And there are conformity assessment bodies, CAB. And who are those? Those are the testing laboratories. So your medical, your pathological laboratory is actually a conformity assessment body. These are the terms used in UNIDO, basically linked to the ISO standard, International Organization for Standardization, which is an international organization for developing international standards. So this is mostly used in those businesses. Healthcare is connected because you have medical lab, you have blood bank, you have biobank. There are ISO international standards for accreditation. If there is any hospital sitting, their labs are maybe accredited to ISO 15189. Primarily, you know NABL. Now QI also accrediting as per ISO 15189. But predominantly there are labs who are accredited by NABL, but the standard is ISO 15189. That's the standard for conformity assessment. And the fourth pillar is smart accreditation. You all know accreditation, right? Anyone knowing about accreditation? Anyone raising hand? All of you know accreditation. Now the word is that is smart accreditation. How you can make accreditation is smart, and I will be talking about little more on that how we make accreditation is smarter. Being in this accreditation for last 20 years, starting from NABL and then NABH and now QAI. So I would like to share my experience in different organizations making. So these are 4 pillars just published by UN organization UNIDO in relation to sustainability of the systems, and it can be any system including a healthcare system. So I would encourage you all to lead it. Now, what are the roles smart hospitals can play? Now, what happens usually when patients come to you? What you do as a doctor, you treat a disease. I come with a headache, stomach ache, or something. You start treating that, right? So what is smarter? And the care is moving from treating a disease to treating a person, treating a patient, treating an individual. Every individual has different physiology, may react to differently to a medication. It may not. So what you do is actually just look at a problem, not as in a holistic. So what we say is shift your protocols from disease treatment to health management, which we call about either patient-centric or people-centric care, which means you have a patient in the center, you have a family member, you have community around, everyone is considered. Now your quest for clinical outcomes and quality. What we talk about is structures, process, and outcomes. That's the philosophy of accreditation system. The structures, how your building is, how your equipment, how your manpower, and the processes. What is your registration process? What is your surgical process? What is your calibration process? What is your maintenance process? And third is outcome. How many of you or us really measure outcomes, right? You really measure outcomes? If you measure outcomes, that's fantastic. But are you doing correctly? Do you know what are the denominators, multipliers, and so on? So how to correct data which is credible? Then retailization of health services means moving to outpatient. Now in US, many hospitals, which are tertiary care hospitals, closed down in pandemic because there were no patients, including India, right? Now many hospitals are seriously thinking to reduce their IP and moving toward OP, because that's where most of people come in and then go into the hospital if there is a need. Then rise of informed patient. Dr. Google exists, so many other platform exists, which gives a lot of information to your clients, your patients. So patient is empowered, patient is well informed. So how to tackle that? Patient would ask questions, right? If you allow, as a doctor, to patient to ask questions. If you don't, then there is no question. But now, there are bold patients. They would ask questions. So are you ready to face those informed patients? The new focus on value and accountability. It's not that, it's no more those era where you come as a things and you are paying. As a patient is payer, whether he himself paying or an insurance company paying or the government paying, someone paying, so he's become customer. So they have a right to ask questions, challenge you, and ask for the accountability as a provider of your healthcare services. Now, how you move towards from a conventional system to a smarter system? Think differently. Think differently. There may be more than one way of doing things. You may be doing things like this, but I would like to do these things, but we reach the same way. You may be a different road travel, but reach to the same destination, right? You go to US, somebody goes by Europe, somebody go by Middle East, somebody go directly. 3 routes possible. Everybody is routing to that specific destination. You should not be resistant. No, I only go by Europe and that's the only thing can be done. No, there may be more than way of thinking, and you should be open to those ideas and views from your staff, from your community, from your patients, anyone who is your stakeholder. Care continuum. Starting from start to finish. Patient comes in, travel entire organization, moves around, diagnostics, labs, OP, IP, admission, treatment, surgery, staying, and goes out. So whole care continuum. It's not just you are only for this. No, it's not. You need to be smarter. You have to pay complete attention at each and every step. One step you might miss the patient. The ability to think and develop ahead of the time, keeping in mind the changing needs and preferences of individuals. And again, I'm mentioning person or people-centric care. Things are changing. My lifestyle is changing. His lifestyle is changing. So we both come with the same problem, maybe different. He may react to your medicine quickly, I may not. Right? I may listen to your command easily, he may not. You say, no, don't smoke, don't take alcohol, I follow religiously. This gentleman does not follow your protocols. So how we can expect the outcome would be same? Right? So I think these are the things which we need to really think in a very changing environment when patient comes with a certain, no, this is my right. You can say, yes, this is your right, but there are responsibility with you as well. And the responsibility to tell me what actually you have been doing. Tell me, last week how much alcohol you took. Tell me truth. So that's your responsibility as patient to share with your provider, care provider, about your own healthcare needs. Measurement, collective collection of data and the analysis. So what happened first time? We don't collect data. We don't have data. So there is no problem. Right? How many patients you have fall in your hospital? No one. How much infection rate you have for SSI? Nothing. What is the hand hygiene rate? 100%. That's what it is, right? So if you do that, and I say, show me the data, you don't have. And if you have, it's not properly collected. So if there are 5 hospitals collecting the same protocol, same parameter differently, so how you would compare this 5? The apple, the orange, banana, watermelon, muskmelon, how you will compare them, right? But everybody claims that this is what I am doing. So I think that should be standardized, and that's why the first pillar is standardization. We should be talking same language, understanding the same thing, because it's changing very fast. And then integrated model of care delivery. Things gone when there was only one facility and you have to do everything there. No, it's not like that. There may be someone talking and saying, you do it this way, go to this hospital, get this done, go to this lab, get it done, go to this place, I'm coming and seeing you there. Different care delivery models. Now tele-ICUs, teleconsultation, home care, home ICUs, home dialysis, RPM, remote patient monitoring, what else, what not, right? So it's not just a conventional walled building now anymore. Change has happened. So there are different models of care delivery. There are integration to be done. Some of the care delivery models, like I just mentioned, conventional hospitals, where you go and then get the treatment done. Home care is rapidly growing, right? Rapidly growing. In last 2.5 years, of course, COVID has fueled that. So nursing, physio, medication, chemo at home, right? ICUs at home, dialysis at home, what not. Then telehealth we now is amalgamated into the system after 2020 April, TPG guidelines published by ministry. So it's being practiced, and now it's not just telehealth, it's gone beyond that. Remote monitoring, of course. Transition care, it's a new area, it's an emerging area. Transition care means you are out from the hospital, you are not going home. So where you are going? You are going somewhere else, right? That was transition care. So this is hospital, come out, discharge, go to this place is transition care. It may be a long-term inpatient for rehabilitation. It may be orthosurgery, it may be cardiac, it may be neuro, stroke. You need rehabilitation for long. So this is the facility for you. And then after getting thing done, you go home. So those are in the transition care centers, inpatient rehab center, assisted living, senior care, de-addiction centers, a lot of type of different healthcare delivery systems for different problems. So this is happening now. Number of transition cares are growing up because the recovery is quick. Patient gets everything what they need to be in a hospital, but not viable to continue in a hospital. Always say, no, you're done. 5 days over, you go. I'm not going to keep you. So you go home, you don't have facilities. You don't get proper care, so you survive somehow. So go to these centers, they will take care of you as prescribed in your protocol. Assisted living, I just covered, is also growing. Assisted living, senior care. So now the question is, what we talk fine, but how to improve? Saying is easy, right? Doing it is difficult. How to improve quality of care? Of course, the first thing is the standards. You choose any standard you like. Any standard you write, you make, you adopt, you choose. Entirely your choice. Then you may have some quality improvement projects, initiatives. I'm not sure whether you know what is quality improvement. If you know, please practice. And it can be anything. It can be just simple, how to reduce patient complaint. Just write a project, how to reduce patient complaint. Just write a project, how to reduce patient waiting time at OPD. How to reduce your discharge time. I'm not even going to how you reduce your surgical site infection, ventilator associated pneumonia, and A, B, C, D, E, F. Just start from somewhere, and if you show improvement based on data, that's quality improvement, right? Patient experience, please get patient experience. I'm not talking about just patient feedback. Patient feedback is this, patient experience is this. Experience. What was your experience? And allow the patient to share everything what he or she want to share. So capture the experience, not just the feedback. Go beyond. Please ask your staff. They are there 24/7 in a hospital, right? Have you ever asked your staff, do you have something to say? Do you want to suggest something to improve? Have you ever asked? Think about yourself. Ask this question from you. They are there. They know everything. They know everything. It's very strong system. You ask the staff, let them say you are bad CEO, you are the worst CEO on this earth. That's the most important thing and most valuable thing for you would be. Because you would know why you are the worst director of the hospital. And if you know why, you answer those why and you will be the best hospital CEO in the world. But that is what we hesitate to, because we don't want to hear something bad about ourselves. So I think it's very important that you take the feedback of staff. Use of data and results. If you collect data, as I mentioned, we don't collect. If we collect, we don't do anything with the data. We keep sitting on or standing on the data or locking the data. If we do, we analyze, but we don't use the outcome of that analysis. Because we have a fear in mind, oh, my infection rate is 16%. If somebody will come to know, what will happen? Why somebody will come to know you? You know, you fix those problems. But we hesitate somehow in sharing, learning from errors and mistakes. Don't think these are errors or mistakes or bad complaint or thing. Take them as opportunity for improvement. Opportunity for improvement. Very nice word, right? Sugar-coated word. Opportunity for improvement. It means, you know, patient complaint. You get the patient complaint, right, as a system. Use them as an opportunity for improvement. Don't think, oh, this patient, next time let him come. No. Take it as a positive spirit. Use of internal and external evaluation. Self-evaluation, self-assessment. Carry out internal audits. You do your own checks, right? Self-check. And if there is an opportunity, get the external evaluation done. Use of technology, digitalization is already, we're talking about that. How you can really make your life easier using the technology, but still you are the master. Not technology should not drive you, drive technology for your benefit, right? Then patient safety is again an emerging word, patient safety, patient safety, patient safety, because that's the ultimate beneficiary in a healthcare system. Staff safety, COVID-19 pandemic taught us that staff safety is equally important as patient safety, because if staff is not satisfied in mind, patient will not get the good care. And this happened in COVID times. When you have not assured your staff that you have been given proper PPE, don't worry, you focus on patient. He won't focus. And if you won't focus, then how the patient will get the critical care appropriately. So you make sure that your staff remains safe at all time. And then of course, accreditation. I put it at the end of this. Usually it is in my presentation is on top, but I had deliberately put it in the end in this smart thing, because that's the end, right? But that's not the end of everything. That's the beginning of something new. Usually people think we got accreditation, we got a beautiful certificate, relax, okay? That should not be. That should be the beginning for your processes. And the last but not least, be with time. Change with time. Otherwise, something will happen which you may not like to be. Now, quickly in last 5 minutes, how we at QI do this smartly and how we try to support any healthcare delivery system in a new way, right? We claim, and I think we are, one of the fastest developing accreditation body in the world, which is evident that in less than 4 years, we developed 14 sets of standards. This was not done in my earlier stint at NABH, we didn't do this many standards. This is our menu card. What we offer, we started with IVF accreditation program, assisted reproductive technology. It's a growing area, growing field. No, there was no regulation at that time in 2017. Now there is an ART Act in 2020 and 21, it is published. But all our standards complying to the regulation. So whatever facilities are accredited, they are automatically complying to the regulation. They need not to do anything. So these promote as a self-regulation. Then we started home healthcare. And when I was thinking about it and put the technical committee on task to develop standards, my own friends from NABH, my other friends from outside, laughing at me, to be very honest. Said, Rana, you have gone mad after leaving NABH. Something went wrong with you. What happens? What are you doing? Home care, what is home care? I said, wait and watch. Unlucky, I would say unfortunately, COVID happened. Now everybody knows what is home health care, right? Everybody was seeking home, oh, I can't go to hospital. Can you get something here itself? So this is now a growing area where we need to come. Then dialysis centers, we develop the programs for Green Hospital, then hospital certification. We have a program for patient safety based on WHO standards for patient safety and patient-friendly hospitals. We have a program for clinics. We have a program for ambulatory care, which is a range, dental, eye, imaging, daycare, surgery procedure, rehab, physio center, anything can come in on OPD basis. Telemedicine recognition program, which we developed based on TPG, telemedicine practice guidelines of NMC, MCI at that time, and telehealth accreditation program, very unique program. So IVF, home healthcare, dialysis, and telehealth, very unique, they were not existing. Not only India, in many parts of the world. Telehealth is, I think we are the second in the world having the standalone telehealth accreditation program after one in Iraq in US. And this has caught attention of ISO to develop international standard for ISO for telehealth. And now these standards have been given to ISO for developing a standard to Technical Committee 304, and that international standards are being developed. And then we have a standard for emergency department. It's focused on its emergency department. And then very unique program for hotels and homestays. Keeping COVID at that time, that patients are being now staying in hotels, how you make sure that the patient remains safe. And then hospital accreditation, we just started hospital accreditation program. Another program, as I mentioned, in transition care. A lot of people who are working in transition care, they approach us that we need a standard. There are organizations, bigger organizations, so they sit together. We have developed a standard for transition care, which we are just going to launch probably next week. The another program in the process is stroke care. So Indian Stroke Association approached QAI and said, we want a standard because there are a lot of things happening. We talk about golden hour, but we not practicing, many hospitals not measuring. So let's have a standard. So we are developing a standard for basic stroke centers as well as comprehensive stroke centers program. So this is our menu starting from, we are internationally recognized by International Society for Quality in Healthcare. We are institutional member. We are on the board of International Society for Telemedicine and E-Health. So we are the first company as an accreditation body from India to join this as a board member. Very happy to say that our standard for for dialysis and for home care are accredited by International Society for Quality in Healthcare, making us the first and only body in India to achieve this benchmark. In NABH, we have only one standard, NABH hospital standard accredited by ISCO. We have two. This is the latest in July, and we got this recognition. As an organization, QI as an accreditation body is now accredited by International Society. So NABH was first, which I got in 2012. Now QI is the second organization in India, but we are the first and only body having standard accreditation and the organization accreditation by ISCO. We were the first home healthcare accreditation provider in the world using the ISCO accredited standard. Even JCI didn't have. In March 2020, we were the first. Then JCI started working on ISCO accreditation, and 2 months ago, they got ISCO accreditation for their home care standard. But we are the first in the world. The good thing is here, after we got ISCO accreditation as an organization, so our standard, the QI accreditation, is equivalent to NABH for CGHS empanelment of hospitals, dental center, imaging center, and eye center. So any 4 categories of organization may have an option. Go here or you go here. For CGHS, you are equivalent. And that's what we were actually working for last 5 years to achieve. We got 50 certification done in April 2022. Steady, slowly growing, but growing in a smooth pace. We're starting some 18 to 22, we are just graphs going. But after this recognition of CGHS, we expect to go little faster than what we have been in the past. This is our gold seal, which can be used by our accreditation partners as a mark of excellence. And we have a certification program which can use this, the blue one, for a distinction. This is my personal thought: quality never sleeps, its practitioner does. This is the practice I have seen in my life since long, that how things change. So this is how we need to change. We can't blame someone else. We can't blame quality that you are wrong. We have to blame us to make sure that what we are doing is right or wrong. Thank you very much. And we would take questions if you have in your mind in the discussion panel. And without wasting time, again, I would request all the speakers, please come up. So any questions for these experts or for me? But the question to you, gentlemen, first is about your whole process, the platform, about different things and doing things. Just one thing, how you can help hospitals in a one line, if I ask, which is difficult to respond. In one line, that the hospital will start jumping on. Okay, oh yes, I will. What can be that recipe for hospitals to adopt?
The hospital management should set the goal and utilize the technology for a better function. That's what I would suggest it actually. Okay. The goal should be
mindset, you know, the mindset of the owners,
yes,
the process owner. Process owner may be the owner of the hospital, maybe the HOD of a specific department. So the process owners basically are the key for success of anything.
Yeah.
If you want to go for anything, they need to understand, and that's a mindset. And that's why one of my dot point was that start thinking differently. Start thinking that somebody else other than me can also be right. It's not I am the boss. No, I am the boss, of course, yes. But he may be the boss, she may be the boss, right? So that's openness, willingness to accept others' ideas. That is how we say. And this is how we train our experts. Then when you go to visit a hospital, don't think that this doctor or surgeon or a paramedic or nurse is doing is wrong. No. You may be doing correct, but you may not be knowing. So please explore. There is no harm asking, can you please tell me how you're doing it? What is the basis? You won't become smaller, right? That is the first thing comes, you know, because you are expert. When you are expert, you are expert. You don't think that somebody can be the expert other than you. So you feel like, I don't know what term I should use. You don't get it to that. And that is why we lose the most important aspect of learning. Because now, somebody is doing correctly, maybe better than you, right? But you lost the opportunity because you have not asked. Would you have asked? You would have known. Maybe you start using in your hospital. And that's why I asked you the mindset. And mindset is start from the journey of the patient as the patient walk into your organization. And then move across. And for your medical, you related to the medication basically, right? Alert on medication. And the medication errors are the second largest cause of medical errors, you know. And that's why if someone was here yesterday, this year International Patient Safety Day on 17 September, the theme was medication safety. Medication without harm. How we can reduce medication errors. What is your take? How, because this is a very complex environment and every hospital is not sophisticated, right? So what is your one-liner for hospitals to reduce their medication? Of course, you have the solution. But again, I want to hear something different, that in practical sense, what they should be adopting and thinking about, that how they can reduce their medication errors.
Yeah, so the hospitals, like in a one-liner, I would put it like this. When the doctor prescribes, you know, there needs to be an alert, and the alert needs to be monitored and action taken upon. So my one-liner is, no data is smart, or system is smart until it is put into use and practiced by the doctors.
Absolutely, absolutely. No technology can give you the desired outcomes until you as a human being really want to do. If you don't want to do, I don't think any technology can work. I know many examples, okay? When human intervention does something different, which are not supposed to be done, your technology would fail. So technology can guide you, support you, assist you in making your life easier, making your life better, not just everything, right? So I think mindset for adopting something, and then how you really think about some problem to address, and then keep doing it. It's not just one time. Today I'm happy, every prescription I'm checking, everything is okay. Next day I'm happy, everything is okay. And then I'm sleeping for 28 days. Then next one, 2 days, I'm again woke up. Oh, let's see. Then again next month. So you don't have continuity. You know, you have 2 days, 2 days, 2 days, missing out 28 days or 29 days in between. So how you will get things done? So I think, again, what I pick up from is the continuity. And that's what my presentation don't point is continuum of care. You have to think in a whole ecosystem. It's not just when patient is within your hospital, even after the patient leave is your responsibility, post-care. So I think thank you so much, guys, for your wonderful one-liner. Anyone has any question before 30 seconds? Yes, gentlemen.
You were talking about different accreditations. Do you have any plans for medical value travel to do this accreditation? And if not, please consider this.
We develop a empanelment program for MBT, Medical Value Travel Facilitator, MBTF. But this was very, very basic checklist. But yes, this is request now coming up after Heal in India initiative of the government. And a lot of travelers who comes and he seeks. And that's also not only just treatment in a best hospital, but post-care, post-op, all this, you know, where they go. You do a fantastic surgery, your outcome is fantastic, but that fantastic reduced to something below the standard when he get admission, infection in a guest house or in a place the person is staying, you know. So what happened? So that medical value facilitator program, that's, we started thinking, but you know, we have a lot of things already done and doing it, but thank you very much that enforces that what we were thinking is right way. Thank you so much for that. Anyone else? Just 2 seconds. Time up, okay. But we are not up. They are here. You can get in touch with them in person, electronically, digitally, whatever way you like for any questions. For me as well, you can interact anytime. I'm here, and then after this as well. So thank you, every one of you, for your presence and your valuable time. Most importantly, coming out of your hospitals or homes today on Saturday. So thank you so much. Thanks, the organizer. Okay, we have some token of appreciation for our speakers.